Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician-gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. I haven't done a live presentation in probably about 2 years. I've been trying to do the recordings in bulk and then just kind of drip them out because I've just been so crazy busy, and I realized I didn't load one up for last week, so I thought, let me just do a live for this, a really quick live. The previous presentation, if you haven't seen it, you'll want to watch that one. But that was basically the killer blood clots, because there are blood clots that can kill us. And they're the blood clots that form inside our blood vessels in our body. So previously I spoke about how certain conditions can set you up for potentially having a blood clot in your blood vessels. And those are predominantly in the venous or the deoxygenated blood flow. If you look at the pictures, it's always the blue lines, not the red lines. So the red lines are arterioles. They carry oxygen to all of our tissues, and the blue lines, those are the venous ones. They carry that oxygen that blood that's oxygen depleted back to our hearts and lungs so it can get reoxygenated. So predominantly, if there's a problem with blood clotting, it will occur in the venous or the blue lines. Every once in a while, it may occur in the red lines, which are the arterial lines. And I spoke previously about how certain things can set us up for potentially getting blood clots. Big one is the genetic factor. If there's a genetic predisposition towards coagulation, or for the blood to be clumpy and slow and thick and clogged together. There's also a potential increased risk of blood clots if you've had damage to your blood vessels. So if you have leg damage, or if, say, you have a lot of varicose veins, so the veins aren't smooth and sleek, they're bubbly and swollen open. If you're pregnant, because that increases hormonal risk for the blood to slow down and to clog up the estrogen levels. So if you're pregnant, if you're overweight, because that puts a lot of pressure on the lower venous supply in terms of swelling and blood flow, and pressure on the return. Also increases estrogen, so it's a hormonal factor. Previous surgery or current surgery, so pelvic surgery is a big one, GYN surgeries, and even cancers can increase the risk of the blood being thick and clumping together and coagulating. And if you have a predisposition and you do any one small thing that could potentially tip the scale not in your favor, you can have a blood clot. And we call those blood clots a thrombus. So it's just a clump of blood that's sitting there. If it detaches and gets swooshed off into the venous circulation or the arterial circulation, it's called an embolism. Now, if someone has a mechanical heart valve, they can get a blood clot on that valve, and then that would go out through the arterial, the red lines. But predominantly, if people get clots and have issues, it's going to be in the venous. So it will be most often in the deep veins of the calf, or sometimes in the superficial veins of the calf. And I thought about this presentation a month ago because Serena Williams, famous tennis player, one of the two Williams sisters, she had spoken quite openly about her medical history of having a blood clot. Now, I used to be I am still a tennis fan, but I used to be a huge follower of all the tennis tournaments, and following Serena and Venus since they were teenagers, of course. And I remember several years back, I feel like it was 2017, maybe 2018, I didn't check the dates, that she had related that she had a blood clot, a thrombus in her legs that got dislodged. It went into her lungs, became an embolism, a pulmonary embolism. And she got that because she was sitting on an airplane, transatlantic, for hours. Now, that's another risk factor. If you're just sitting immobilized, especially on a plane, your legs are bent, so you're increasing the pressure. There's swelling that decreases or stagnates the flow. The blood doesn't circulate well. It kind of swirls around. You get a clot in your calf. Once you start walking again, it dislodges, it flies up into the lungs. You have pulmonary embolism. Pulmonary embolism has a 50% mortality rate. 50% of people who get a pulmonary embolism will die. So she was short of breath. She had symptoms, short of breath, didn't feel well, couldn't catch her breath. She went to the emergency room. It actually took them a while, apparently, to figure out that she had a pulmonary embolism, which is surprising to me, but what can you do? So it took them a while, apparently, to realize that she had a pulmonary embolism. They treated her for it. The treatment can vary depending on whether you still have portions of the clot there, what the origin of the clot was. Did she have a genetic predisposition, or was it just bad luck because she was sitting on the plane for so long and didn't drink fluids, blah, blah. So, as they say, long story short, Serena Williams had the pulmonary embolism. She was in the 50% who actually survived it. They gave her medication, which is usually going to be a blood thinner, heparin or fractionated heparin. And now, I've already told you that a risk factor for having a blood clot is just pregnancy by itself. Another risk factor is actually having had a pulmonary embolism, or obviously a thrombus in the past. A deep vein thrombosis is what she had. So Serena gets pregnant, and as we all know, shockingly to me, what you're supposed to do when someone's pregnant and they have a history of DVT, a deep vein thrombosis, especially pulmonary embolism, in the past, you're supposed to put them on medication to prevent that immediately, because now they're a huge setup for getting another pulmonary embolism. And guess what? They may not be so lucky second time around. Shockingly to me, she didn't get any medication to prevent another thrombus. I don't understand that. So they just knew her history, because she was quite vocal about it. And of course, she's not a doctor, so she didn't know that she was supposed to be treated in advance. So she did not get any medication in advance. Sorry, what'd you just take, Shakoya?
Marco.
Okay, so bring it back, please. Sorry, I'm in the office. And she went through the whole pregnancy, surprisingly, without another clot. Now, another risk factor, as I already mentioned, for having a thromboembolism is pelvic surgery. Not only did she have a risk factor of a clot in the past, a DVT, and a pulmonary embolism when she wasn't pregnant because she was sitting on a long flight, not only did she have a second risk factor that she was pregnant and had increased estrogen levels and hormone, she had a third risk factor because she had pelvic surgery. She had a cesarean section, and shockingly, her doctors still didn't give her any medication. So every single person, I don't do obstetrics anymore, but when I used to do obstetrics, if she didn't have any history at all, after C-section, we always gave them 1 shot of heparin, because pelvic surgery, which is what a cesarean section is, increases your risk of clotting. We give them 1 shot of heparin. We put pneumatic compression devices, which are little plastic devices on each of the leg to keep the blood flowing, to decrease the risk of an embolism. And we'd have them get out of the bed and walk that night to the restroom. We'd take out the catheter, everything. They didn't do any of this for her, and I'm flabbergasted that she didn't get any kind of preventative measures, treatment for an embolism. And she didn't have 1, she didn't have 2, she had 3 risk factors for a pulmonary embolism. Then, if you're aware, because Serena's very, very vocal, she gave an interview about the fact that she had symptoms of another pulmonary embolism, and because she'd had a previous pulmonary embolism, she told the nurses and she told the doctors that she felt she was having a pulmonary embolism. She needed to get tested. They didn't believe her. I don't know what's going on in the medical field lately, but they didn't believe her. They did a sonogram of her legs, which we know isn't the gold standard. The gold standard is having CT. So she had to tell them, she had to talk them into appropriately evaluating her so that she could get diagnosed and treated. And that's just atrocious, absolutely atrocious in my opinion. And I never believed for years that there was an increased rate of maternal mortality and morbidity for Black women because I'm a Black woman, I'm a physician, I'm an obstetrician, gynecologist, and I did my training at Bellevue Hospital, NYU. We never treated patients differently. We treated patients the same. I always treated patients the same, full on, 100% effort. Didn't matter what their race was. It didn't even matter if they could or couldn't speak English. So I didn't understand why people were saying there was a higher mortality, morbidity for Black women because I didn't see it in my scope here in New York. I didn't see it at all. But when I hear that story of Serena, it makes me think that maybe there are a lot of providers. I know the statistics say it's increased, but I thought, oh, maybe it's just you have people who aren't following the doctor's instructions, maybe they're not understanding it, or maybe they don't realize the importance. I just thought it was kind of a happenstance. But when I hear Serena's story and I look at the poor care, I'm going to say it, that's poor care, that she got, I'm starting to really believe that subconsciously, because I still have a hard time believing that people are consciously mistreating women of color, just because I just really have a hard time believing there's that many prejudiced or racist people in healthcare and they're all colluding. I think there's a subconscious predisposition to not really consider circumstances and to not be on a high alert as they would if the person looked like themselves. And that's a sad statement, and it's a sad state of affairs. But I brought this up because I had a patient recently who was on estrogen birth control pills, and she had a history of a stroke, so which is a embolism, a clot, a thrombus got embolized in the brain. And I also had another patient who had a history of migraines with aura, or some people call them ocular migraines. And those are scenarios where the pain of the migraine occurs after the person has visual disturbance. Medically, we know that increases their risk of strokes if they have a migraine with aura, if they're on any kind of medication with estrogen. So with all of these circumstances, and especially someone like Serena, who's high profile, well known, they did not have the, I don't even want to say foresight, but more like awareness that maybe they should give her the best absolute care because they don't want any complications from her. The whole world's going to hear about it. It wasn't even important enough for them to treat her as the star that she is. What kind of treatment will the rest of us get, because we're peons and we don't have a world platform like Serena did? So I decided I would do this presentation the other week on blood clots, thromboemboli, and pulmonary emboli, what your risk factors are, and the management. So if you have a risk factor for any of those clots, you're supposed to be evaluated by a blood specialist at the hematologist and avoid entering other scenarios which also increase your risk of a repeat performance. And pregnancy, birth control pills, hormone replacements, all of those sitting immobile for hours, all of those factors will always increase your risk of a repeat performance, repeat embolism. And if you get a pulmonary embolism, 50% chance of mortality. So I'm going to end this presentation here. Thank you for joining me on the killer blood clots. And you have a great rest of your Monday. And almost forgot, check out the podcast, GYN Corner. Check out, you're obviously with the Facebook. Check out the YouTube. It's also GYN Corner. Take care. Have a blessed day.